In shortly, Chairman.
Oh, yes. Yep, live.
There you go. That's come up now. I'm sorry I couldn't get it on my screen. Thanks very much, Alan, as always. Thank you.
You are live, Chairman.
Thank you very much, Mr. Twyman. Appreciate that. Welcome to the Policy Overview Committee. I'll start with apologies for absence, which I've had from Councillor John Burrell and Councillor Julie Ozog. Are there any other apologies?
I'm not aware of any, Chairman.
Thank you. I cannot see anyone else indicating. Are there any declarations of interest? Again, I can't see any. Thank you. No declarations of interest. I'd like to propose the minutes of our last meeting.
Agreed.
Are people happy with the last minutes? Thank you very much. There are no urgent items. There are no references from any other committee. I propose that we note item 6, which is the Regulation 9 notice, unless anyone has any questions or comments. Okay, I can't see any. In that case, we'll move on to the substantive items, and first of which is an update on the impact of the pandemic in Dartford, Gravesham and Swanley. I'd like to welcome Mr. David Meikle to the meeting. Thank you very much, Mr. Meikle, for attending. I really appreciate it. I understand, do you have a presentation for this item, or is it the next item?
It's the next item, Chair. Next item.
Okay, so in that case, I'd be very grateful if you could perhaps just introduce yourself to the committee, and are you able to give a brief summary of the pandemic in Dartford? Thank you.
Thank you very much. Thank you, Chair. If I can introduce myself to begin with, my name is David Meikle. I'm the Interim Director of the DGS ICP and Director of Integrated Commissioning. The previous post holder left the organisation at the end of the last calendar year, and an appointment process has been put in place, and a new substantive director, David Peck, is due to start at the end of this month. So I was asked to stand in by the CCG for 3 months just to cover the post of the ICP director and give leadership and support to the ICP team in DGS. So that's my background. I've an NHS director for a number of years. I've worked in Kent and Medway, including the previous Dartford CCG. So I've got some knowledge of the area, and as I say, I worked extensively in the Kent and Medway system, both in finance and in general management. Moving on to the item itself, it's just a very brief update on the pandemic and the impact on DGS. I should start by saying that where we are at the moment is materially different and improved from where we were 6 weeks ago. For an example, 6 weeks ago, we had over 400 COVID patients in Dartford Valley Hospital, and as of today, we've got 45. So give you a scale of the difference that's happened in that 6 weeks. I should say at the present time, we have within the hospital, there has been a step down in any excess beds, and we have now reverted to normal staffing levels. There's been tremendous inter-organisation and inter-system working to ensure that discharges and patient flows work effectively through the hospital, and that's right across the system, where we've introduced on the back of the pandemic a number of services in the community, oximetry monitoring services for people managing oxygen levels, COVID positive patients at home, and keen monitoring of their oxygen levels, which has worked really effectively and meant we'll be able to manage a large cohort of patients within the community. Secondly, our treatment escalation plans for care homes. Here again, GP monitoring of patients and COVID positive patients within care homes to ensure that they can remain within their care setting, which has worked effectively. And we've had really excellent working between the community hospitals, social services, and the acute sector and GP and primary care. So I think that the system was under tremendous pressure 6 to 8 weeks ago, and we think we've come through that wave. Obviously, at the same time, both within the hospital and in primary care, we're in the vaccination programme period now, and we're moving into continuing with the first dose of the injection and moving to the second dose of injection now, given that the first dose was given 10 to 12 weeks ago. So we've got a cohort of staff and patients getting their second dose. So all in all, Chairman, I think we've come through a fairly extensive and challenging period, really due to the support of staff and the community. We'll be able to move forward positively and come through what was a very challenging time, and what we felt within DGS was mirrored across Kent and Medway and mirrored across the country. And I think we went into this wave slightly earlier, partly because of the Kent variant, as we know, but we've come out of it earlier as well, with some low numbers compared to some other parts of the country. At that point, I would stop and take any questions, Chair, on the update.
Thank you very much, Mr. Meikle, for your update. I'd like to firstly place on record the Council's gratitude to everyone in the borough who works in the health service for their service over it's actually a year, exactly 1 year ago today, I started working from home instead of commuting into Canary Wharf. So I'm very, very grateful for everyone, not just doctors, nurses, but everyone who supports directly and indirectly the work of the hospital and the health service in the borough. And please, can you pass that on to your team? Thank you. There's one question that I'd like to ask, and then I'll open it up for questions. If councillors could please clearly indicate as clearly as possible if they've got questions, then I'll come to them. But firstly, Mr. Meikle, it's pleasing to hear that things seem to be getting better. But are there structural changes that you can now make during the course of the spring and the summer, in terms of the physical building, or how you organise your staff, or how you what protective equipment or what medicines you need? Will you be able to make substantive changes during the next 6 months in preparation for next winter? Thank you.
Thank you for that question. It's a very good question, and the answer to that is yes. I think as we've come out of this, there is a two-pronged approach. One is to look at the recovery of the planned and elective care. As you know, the number of our services were paused as we dealt with the pandemic, and the phase we're moving into now is the recovery phase, and looking at those long waiters and those patients who chose not to get treatment for various reasons, and we're looking to move forward in that area. So plans are emerging in that area. Secondly, it is about also, as you say, preparation for later on in the year and for next winter. There are a number of really innovative ways of working that have emerged across the system, moving away from sort of primary care, community and acute in the silos, but looking at the system as an integrated system. And we can look at, I think, the hospital at home team that come from they're based in the hospital, but they're providing services out in the community alongside their GPs who are providing those oximetry services and treatment escalation plans. All of those are working in an integrated fashion. Secondly, I think the innovation on virtual appointments for outpatients and making sure that we can get the benefits from technology and the changes that have been helped us cope with the pandemic is building on those technological changes that patients now have got experience of and can understand how they can work and can save time and travel time as well as being very, very, very effective. So there is, as I say, two-pronged attack in preparation for recovering the elective position and preparing for next winter. Very much in a planning process at the moment.
Thank you very much. I have Councillor Jones, and then I have Councillor Green. Councillor Jones first. Thank you.
Yeah, I just want to start by saying thank you to the NHS for the wonderful job they're doing in supporting COVID patients. I know first-hand experience of that after spending 8 days in hospital myself with COVID, with pneumonia, and then long COVID, as I still have now, after developing it on Christmas Day. My question, though, David, is in terms of me looking up long COVID, which I did, it talks about the 67, I think it is, long COVID centres that they've got across the country where the government put in £10 million towards that. When I looked up where our nearest one was, it was either in Sussex or Homerton Hospital. When I spoke to my GP, because obviously she referred me to long COVID, and I'm asking this question not for myself because some of our residents within our wards might have the same issue. Where is our local COVID centre? And if there isn't one at the moment, will there be one soon?
Yep, ours is being planned for the Maidstone area, and I will confirm that, Councillor, to you with regard to the implementation plan of that. I don't have that detail, but I will get that information for you. But also, it's a hub and spoke model, so we will be looking to have local services as well as the long COVID hub, seeing being based in the Maidstone locality. So that's the overall sort of the thrust of the matter. I'll come back with the detailed implementation plan if that's helpful for you. But also, I
appreciate that, David. Thank you.
But also, we are looking in the area about our level of community respiratory services, and we're putting an investment business case together to the CCG about looking to expand those community respiratory services that can help patients and will help patients with long COVID as well. So it's a bit of a twin track approach to try to tackle that issue.
Thank you for that, David.
Councillor Green.
Thank you, Chair. And may I just associate myself with your comments, Chair, about thanking all the staff that have worked through this pandemic in the NHS. I've got two questions. The first concerns staffing. Have staffing levels remained the same throughout the pandemic? Are we losing more staff than we did previously, or is it about the same? Have we got any concerns with regards to staff retention? And if so, what is being done to overcome those problems? And secondly, I'm concerned about the people that haven't gone to appointments or have chosen not to, or haven't been able to, with other illnesses that haven't been diagnosed as a result of the pandemic, which I know Macmillan have expressed a lot of concerns about. Is there any work being done to try and get people to come towards those appointments and to catch up with what might be a backlog of things like cancer diagnosis and so on and so forth?
Yeah. So on both of those, I think the staffing levels have returned to normal. So there was an increase in staffing levels through banking agency and short-term recruitment to help us cope with the additional demand and the additional beds that were opened both in the acute and community settings. As activity levels have fallen back to normal levels, staffing levels have fallen back to normal levels as well. And that also does reflect on staffing sickness too, where we're looking at rates that are back to normal levels that you would expect. With regard to retention, I don't have the detail of that for the acute trust, and community, but I can get that for you as well, Councillor. I don't have that specific detail for that, but I can access that and come back to you on that. With regard to patient priorities, you're very much highlighted those patients that the health service as a whole will be targeting as the priority. These are in our priority terms, those patients who need to be seen and should be seen urgently will be at the top of the list, and also those patients, as I said earlier on, who we viewed should be seen, but through concern of the pandemic itself, chose not to come into the hospital environment, and those are the patients that we're following up urgently to make sure that they get an appointment as soon as possible. That's very much at the heart of our initial recovery plan.
Thank you. Mr. Meikle, in the preparation for this meeting, it became apparent that the trust board for the Dartford and Gravesham NHS Trust had seemed to have been abolished, and I'm quite keen to understand how we can have democratic representation on the running of that trust, which we have had historically. Councillor Allen and Councillor Peters, who are both in this meeting, are representatives, and they have responsibilities for health at the council, and are keen to input and be involved in the oversight of the Dartford and Gravesham NHS Trust. Do you know anything about the re-establishment of that board, or how representatives such as those can oversee the trust? Thank you.
I don't, but I will find out for you on that one. I know there was a push to get back to normal governance processes across the health service, and I'm sure that will be part of it, Councillor. But I'll pick that up. Yeah.
Okay, thank you. Ms. Green, who's the director at the council, she's also contacting the trust to try and establish that as well. But okay, yeah. Thank you very much.
Yeah.
Are there any other questions? Okay. In that case, we'll move on to
Matthew, Chairman. I just want to make a comment on that.
Thank you.
I understand, and again, I want to reiterate our thanks for everything that you do. But I want to just make it clear on behalf of the council that we have a wonderful community out there, and we have a lot of things that we could do. If you can stress to the board that if you engage with us through the council, that I'm a great believer in some of this social prescribing and things like that, and the work that we do with the GPs. And I think there's a marvellous resource there for you, which is basically, again, we're looking at new ways of working and everything like that, and as we come out into recovery. But there's a fantastic community resource out there, and we could save you money. There are a lot of things that don't cost anything that we could be. And I know perhaps you think it's perhaps in the smaller scheme of things when everything up there, but we really do want to engage and work with you. And some of the fantastic things that we're doing, even if you just look at, our sports facilities, our parks, all the voluntary sector out there who's prepared to help and support, and that spirit has really come forward during the pandemic. So I think, again, it's a wonderful opportunity to have a look at how we rebuild and reform for the future. So I just want to say that certainly myself and Mrs. Peters and the director and all of Dartford Council would want to work with you and do what we can to have a healthy community.
Great, and that's super. And then behalf of the ICP, I really welcome those comments, and I think it goes to the heart of what our vision is as an ICP, to look at that community-based, patient-centred approach to the provision and the redesign of services. So thank you very much for those comments. I do appreciate it. Thank you.
Thank you. If we could move on to agenda item 8, I believe there's a presentation which hopefully we can share for this, which is the I've been very keen to understand what the plans are for the general practice provision within the borough. So thank you very much, Mr. Meikle, for presenting on that. And Just waiting for the presentation to come up. Oh, there we go. Whenever you're ready, Mr. Meikle.
Okay, thank you very much. Can we have the next slide? I would say, Chair, in introduction of this item, that because of what's happened in the last year, as you say, it's almost like the anniversary of the first pandemic. The work on the estate strategy and the plans that were put in place were suspended through the calendar year 2020, and it's only now we're beginning to pick them up as we come out of the pandemic and move into recovery. So I'm conscious that previously that the committee had a presentation from the previous director that spoke about the primary care estate, but what we're keen to do within the ICP is look at all the estate, and it's not just primary care, but look at community and acute estate as well, and also look at the potential across the public sector as a whole to see how what the benefits that we can deliver by looking at a fully integrated approach to a public sector estate in DGS. And as you can see, the objectives of the emerging estate strategy within the ICP will be to identify those the benefits of working across sectors and across organisations, but also looking to see where we haven't got it right with regard to provision, and look to develop particular business cases to support further investment in the area, and recognising the challenges that we've got within DGS and the opportunities of the development at Ebbsfleet, both the developments on the housing front, but also on the Linden Resort, and on the potential for a diagnostic care hub in that area. But secondly, picking up the challenges that we spoke about around about COVID, and how can we redesign services, but recognising that patient demand has changed and will have changed as a result of COVID, and what do we need to do to redesign and shape services in order that we can provide a more effective service. And it goes back to my response to the councillor regarding long COVID as an example of what we need to do in order to take that forward. Maybe the next slide, please. So the approach that we're looking to adopt, as I say, is looking at a fully integrated approach across DGS, looking at all partners and all stakeholders, and developing the strategy in an inclusive manner. At this point in time, we are concentrating on the clinical model to ensure that we've got that right, and picking up my point about the demographic changes, especially around about Ebbsfleet, and the potential demand changes round about COVID. But the key commitment from the ICP is that we want to do things that are, and do things in a manner that is fully integrated across the geography and across organisations. The next slide. Our vision is very much is to create that long-term sustainable healthcare system where primary, community, acute and other services work seamlessly together with local authorities and voluntary sectors, independent organisations, to improve the health and well-being, and that's important as well, the well-being in our communities, to ensure this sustainable economy. So it's about getting the right estates to support the right clinical model, and making sure we use the best use of technology, picking up the comment made by the councillors about what support we can get from the communities and how we can work with the communities, ensuring that we drive healthy, sustainable living, because we know part of the challenges we had around about COVID was the underlying health of the population, and the health challenges of that population did drive some of the impact of COVID in some areas. So we know that the whole public health and well-being agenda and the preventative agenda has got to be at the heart of anything we do. But we also recognise that the growth in population in DGS around about the Ebbsfleet Garden City, and across the DGS as well. So it's a combination of the growth and development, but at the same time working differently and recognising the new challenges being faced by health and social care. The next slide, please. And this slide just reinforces that, Chair, that the strategy is intended to support the local health economy, to have a fit for purpose estate, but recognising the demographic and population changes, recognising that healthcare services will change in how they are provided, and reflecting on the innovation that happened in the response to COVID, and taking the best things and building on those, especially the opportunities of technology that offers us, but recognising that services will change and will develop as a response to the impact of COVID and long COVID, as we've spoken about. And how are we going to do that? Well, the next slide goes into that, and I think the next financial year, 21-22, it's about finalising that clinical model that was spoken about, and then say what is the correct estate, what is the best estate, the fit for purpose estate that links in with the digital strategy and the urgent care plans across DGS, and looking to see what we can do with regard to making better use of that estate. What do we do with regard to further developments and further investment to maximise the estate, both in primary care and in community and in the acute sector, to make sure we've got it right. It's working with the local planning agencies and yourselves to make sure that we've got the funding flows and the delivery mechanisms as detailed in Section 106 funding, and to show that we've got that clear partnership and engagement working together to get the right estate to support the right services that their population demand and are looking for. And finally, I think in conclusion to that I stress again that the vision's got to be clinical led. We recognise that we're not in the place we want to be because of the pandemic. We've been paused for a year. I think that it's about picking the whole strategy up again, being committed to the integrated approach in order to take it forward, and recognising that some of the challenges are the same that probably were spoken about to you previously regarding the demographic changes and the additional population coming to the area, but also things have shifted round about COVID with regard to the health of our population, and also about the underlying conditions that we may need to change services in order to address round about long COVID. So it's more of a position statement, Chair and Committee. There's nothing tangible there at present. Work is afoot in order to reinvigorate and take forward the estate's plan as part of that whole recovery plan, looking to see how we can get the clinical model right and get the right estate to support that clinical model. At that point, Chair, that's the end of my presentation, and I would pause and take any questions that you may have.
Thank you very much. You mentioned the demographic changes a couple of times. But based on the council's, obviously the council is closely involved in forecasting housing numbers. Based on the council's annual monitoring report in January 2020, the population purely of the borough of Dartford is forecast to increase by 40,000 people between 2011 and 2026, 15 years. I get a little bit frustrated because the growth has been known for many years, and as far as I can tell, there's been no new GP surgery opened in the borough for many years. Preparing for this meeting, I remembered that I go to Dartford West Health Centre, and I remember it being extended. There was an extension to it, and I looked that up, and that was 18 years ago that was extended. It seems only like yesterday, but are there any plans to open new GP surgeries in the borough in the near future? Thank you.
at that point, I don't think that there are in the near future. Obviously, as part of the strategy will be to identify that growth that you've spoken about and been seen to respond to it. I think that's without the benefit and the real benefit, I think, of the ICP taking such a localized focus on the borough and also doing it across the sector. I think we can really look to see how we can maximise that investment in the short term. I'm working with the director of estates for the CCG and ensuring that whatever we develop locally is aligned to their plans, because that's where the investment funding will come from, and we need to ensure we've got that complete alignment there. So that's the commitment that I give you, that will be part and parcel of it. And I understand your frustration, and that it hasn't been addressed before now, but it will be. I think it's part of the next steps.
Thank you. I have Councillor Nicklin, but I've got a couple more questions myself. Does the Department of Health set a requirement for the amount of GP provision in a given population, or not? Do you know?
There's a specific ratio for what would be an effective practice size, but I don't think that it's actually determined by the number of GPs. I don't think it's as clear as you need to have X number of GPs for X number of 100,000 of population. I don't think it is as clearly mandated as that, Chair. I think it is very much a developing provision as a population develops.
Sure. Okay. I understand that one of the GP surgeries in Dartford, not Dartford West, but another one has over 20,000 patients, which to me seems more like what a hospital would have rather than a GP surgery. It does seem to me that there is incredible pressure on our GP surgeries. I appreciate that circumstances are different at the moment, and I would welcome sort of technological improvements to Zoom in the future. But is 20,000 patients for a GP surgery, is that appropriate? Is that, would you say?
I think it depends on the conditions. It depends on the number of GPs supporting that. It depends on the size of that practice with regard to the estate itself. So there are practices who have that, and it's an effective level of service because of the number of GPs supporting that that volume of patients. So it's difficult to answer in a straightforward yes or no on that one.
Okay, thank you. And finally, from me, in our planning, in the council's planning, we often have references to health hubs. The phrase health hub is frequently used in planning and setting out infrastructure requirements. Are you able to explain what a health hub is? I presume it's a GP surgery with additional services, but if you could perhaps explain from your professional point of view what a health hub is. Thank you. Then I'll go to
from my perspective, a health hub is, as you say, is got that primary care focus in health, but has got a wider range of providers within it. So you may, for example, have a mental health provider alongside the primary care provider. You may have some citizens advice bureau. You may have some voluntary sector alongside it. So you have a plethora of providers providing health and social care in a multi-agency environment close to the community that they need. So rather than the patient and the community having to travel around, everything is concentrated within that hub. There may be increased diagnostic services, for example, in the hub too. So maybe the development of X-ray facilities or minor injuries units can develop within a mine hub. So if you look at something similar over at Whitstable, for example, and what's happened over there, you can see how that something like that hub can develop in that environment.
And vaccinations as well, presumably.
Yes, yes.
Thank you very
yes,
much.
yeah.
I'll have Councillor Nick Lynn, then Councillor Ben Mooser. Thank you.
Thank you, Chair. And thank you, David. It's a really interesting presentation. I mean, there's so much going there that really affects us in our part of Dartford. We are looking forward to our first health hub in Ipswich as part of the master plan, as you said, although that is a few years away. And we're looking then to have a number of integrated services, from support services, clinical and non-clinical, as well as additional GPs. So that's really exciting, because we do have real pressures in our part of the world where Ipswich residents are registered with local practices, and then obviously that puts a strain on the existing communities, particularly, I think, sure Councillor Ben Mooser will echo the sentiment, Swanscombe GP practice or Swanscombe Greenard GP practice that's next to Ipswich Academy. The point I was going to make was for me, it's around what we can do more to support pharmacists in particular, because people don't realise, and there was a government campaign about this not too long ago around supporting our pharmacists and really encouraging the population and educating the population around the fact that pharmacists can do so much more than just prescribe medicines. They can do a whole host of things that can be done at GP centres and the GP. So a number of my residents could easily go, if they knew about it, could go to their pharmacists to get things. And in fact, now I think some GPs and pharmacists rather can do vaccinations even. So while we're waiting for additional, as the chair mentioned, additional GP capacity to come online, I really wanted to know sort of more about what we're doing in Dartford for us to really promote services that pharmacists can offer residents. I mean, because locally here in Ipswich, there was an application for a new pharmacy in Ipswich, and I believe it was the CCG, or I may have this wrong, but it's certainly somebody within the health remit said that there was no need, and so the application was rejected. It was overturned on appeal, and we are looking forward to that pharmacy opening up in Castle Hill in the near future. But it's just things like that. If we're really going to be walk the walk around empowering pharmacists to take some of the burden from GPs, so far we haven't really done a great job of it. So just interested to hear your thoughts on that.
Yeah, and I would support your comments 100% about the effectiveness that pharmacists can make in the whole provision of primary care. They are very much a major tool in the provision of that primary care provision, as you describe, and can share the burden with other primary care practitioners, including GPs. So I'm very much a supporter of that, and I know that Bill Miller, who's the Director of Primary Care for Kent and Medway, is very much of the same mind, that he sees pharmacists playing a key role in that whole primary care provision, and he is very supportive of looking at the range of services, including, as you say, flu vaccinations. And to be honest, I got my own flu vaccination from a pharmacist this year. So I would wholeheartedly support that provision. We do need to promote it harder and faster, and I think that that's something I'll take back to Bill and within the ICP to make sure we've got a cohesive approach across Kent and Medway and within the ICP to develop and promote those services.
Thank you. Councillor Nicklin is one of the councillors for Ebbsfleet, so hence his particular concern. Councillor Ben Mooser.
Oh, yeah, thank you. Sorry, please excuse the camera being off. I've got a 5-year-old behind me. My question was regarding waiting times. I am neighbouring Councillor Nicklin in Swanscombe, and we're feeling the pressure. Some of us are waiting 2-3 weeks for an appointment. And if we can't get one, people just call 111 or they end up at Darren Valley Hospital. So I am concerned that there is nothing being built in the future. But is there an impact assessment going on at the moment for the area with Ebbsfleet to see if they can continue building without any more GPs?
Well, there is, and it's part of that whole the Ebbsfleet development, as was alluded at the last conversation with the councillor. There is planned investment for the Ebbsfleet area as part of the growth in the population. We've got a site earmarked on the Ilkerdene development for the additional GP and health and wellbeing centres, and the actual programme of looking what goes on within that facility is started, and we're picking it up with EDC on looking at engagement and consultation on what that centre will provide. But at the heart of it, there will be additional GP provision going into Ebbsfleet.
Thank you. But in the meantime, there's no expansion of Darrant Valley. There's no additional GPs being built.
In the meantime, that's the case. But as part of that, the work that's happening across Kennan Medway and within the DGS, we are looking at the overall estate, primary care estate, related to that demand and that growth in population in this area in particular, and that will be picked up within that whole estate strategy.
Okay, thank you.
Thank you. Councillor Jones.
Okay, yeah. So thank you, Chair, and David, thank you for also in your presentation adding the long COVID part of things that are happening. That's great to hear. Just going back to that very quickly, in terms of how long this has been about now, I did some research while I've been off sick, and there was a marathon runner of 32 years of age who's had it for over 10 months, who's had fatigue, chest infection, not being able to walk very far, and couldn't even do basic yoga. And he's still suffering with that. So I know that there's a lot of people out there that have now got this problem and this issue. So my question to you is, when I, first of all, before I ask the question, when I went on Facebook and shared my journey, I was surprised by how many people were coming through saying that they had the same issue, either for longer or asking me questions about my journey. So my question is there any way we can get some medical pamphlets out there now about long COVID so people have a better understanding of what that looks like? Because it's important for us as councillors to be able to share that with any of our residents if we come across them who are suffering from long COVID. And I appreciate the fact that you also said about the hospital situation opening in Maidstone. If you could just let me know roughly when that would be as well, that would be helpful. Thank you.
Thank you. Yeah, and I will do that. I said, when I will get the information on that long COVID, councillor, and I will get that to you with regard to the implementation plan and that hub and spoke model and what it means for services in DGS as well. And related to that, I'll look at what the communication plan is with regard to publicising that service and publicising the potential conditions of long COVID and how we can help respond to that as a service. So I will pick that up. Yeah.
Thank you. Are there any other questions? Sorry, Councillor Garden, then Councillor Currans. I think you're on mute, Councillor Garden.
Sorry, I sit down, wrong place. David, we've heard lots about estate planning, bricks and mortar and the like. We've heard about the problem of 3-week delay to get a GP appointment in Swanscombe. We must look at it now. What plans have we got to increase the number of GPs that are in Kenton Medway? We have GPs obviously retiring, so there's always a wastage. We have a large 40,000 increase within Dartford itself, but I didn't see anything in your presentation that indicated initiatives with the universities or anything else to get the GPs in. We don't need the bricks and mortar. We've got some. we can squeeze more GPs in. They can work longer hours. They can work Saturday. So we've got enough real estate to just do it. What we haven't got are the people. Also with the community nurses. What plans do we have to increase the number of doctors, and by how many, and by when, and similarly with community nurses? Thank you.
Okay, well, I think I was asked to talk about the bricks and mortar and what our plans were to develop the estate strategy and the investment plan, Councillor. So
apologies, I've taken outside your remit. Yeah.
No, not at all. But I think your point is well made, and I will take that back to the Director of Primary Care. As I said in my introduction, I've just been interim for a couple of months, but I will look at the overall plans for recruitment of GPs. I know there is a recruitment plan in place to pick up, as you say, that natural evolution as people retire, and we do have a programme across Kent and Medway to recruit to that. But I will get the specifics with regard to the numbers that are being recruited to, but recognising the problem that we are specifically dealing with here, which is that growing population and the need for additional GPs over and above just the recruitment of those that leave, to cover those that leave. But I'll pick that up.
Thank you.
Councillor Currans.
Thank you, Chairman. My question I keep asking, and every time we have anything to do with the health, are there any hospitals about to be built? We keep hearing about clinical hubs, which is great, but we need hospitals. I know these places can help on certain things, but we do need hospitals, and there's never, ever any mention of a new hospital being built.
Within DGS, there's no plans for a new hospital. There's, as I said earlier on, there are specific plans related to Ebbsfleet, and there will be, I think, other plans emerging related to the estate strategy when we look at the growing population in other areas of DGS. But at this point in time, Councillor, there's no plans for a new hospital being built. There is a national hospitals programme across the country that the Prime Minister has announced of 40 new hospitals up and down the country, but none of those are earmarked for anywhere within Kent and Medway at this time.
Don't you think that there is a great need, particularly with all the building that's going on, with us being so close to London, and with the fact that we've got the A2, the M20 and the M25, the hospital that we have got, very, very good, and nobody could make any complaints about it over this COVID period. They've been absolutely fantastic. But how can they cope if we were to have a huge disaster? Where are people going to go? But, you know, it's just something that really does get to me. I really do think people should be thinking about building hospitals.
Okay, all I can do is take that back to say there's nothing in the pipeline for this area at this point. Thank you for your comments, and thank you for your positive comments about the hospital. It is, because I do agree with you. Yeah, thank you.
Councillor Nicklin, did you want to come back on another point, or were you indicating from earlier? No, I'll in that case, I'll go to Councillor Sandhu. Welcome to the meeting, Councillor Sandhu. Can I just first check whether you have any declarations to make? Thank you.
No, none, Chairman. Many apologies for the lateness. I had my first vaccination today, so I just got held up over there. I do apologise. And
don't look
great
old
service that is, may I say, in and out like a rocket it was. So yeah, no, thank you very much. I just wanted to say, again, myself and Councillor Currans, we raised the issue on multiple occasions regarding the hospital itself. You, David, may be aware that in the past we've had many issues regarding our residents, which just touch on to the boundary. Most likely isn't your remit, but I'd just like to bring it up again. Car parking facilities. Now, as kindly the councillor for Ebbsfleet, Councillor Nicholl, mentioned that the population is growing day by day in Ebbsfleet and the surrounding areas. Where are they all going to be parking? Are they going to be parking back in Fleet Estate and in Darenth Village? You know, although Darenth Village has a permit control, but we do keep facing this issue, not lately over COVID, right? Okay, because everybody's been at home effectively, but otherwise in the past, you know, I've represented the area for, what's it, about 5-6 years, and we've always had this issue. And every time we've spoken to Darenth Valley management, etc., yes, we will get this resolved. We're going to have a parking application coming in soon to build a new car park. And that was at the first meeting, the public meeting that we had, and that was 6 years ago, roughly. And nothing's ever evolved. And I think we need to resolve this issue. You know, we are coming, touch wood, to the end of the COVID situation now. And, you know, when life begins to get back to normal, we are going to find the same issue, especially with residents within the borough and surrounding areas increasing. So, you know, you've mentioned that there is no expectation at the present moment of any future hospital being built. So it's Darenth Valley that has to put up with all the issue along with the residents. So, you know, your thoughts will be much appreciated on this. Thank you.
Thank you. That's one of those naughty issues around about every hospital is car parking. It doesn't negate or minimise what you've said, Councillor, for the local challenges, but it's very much a live issue. I don't have any background to it. I don't have any knowledge of it. All I can do is take that back to the trust management team, and hopefully they can respond to you positively. But I know there is a push to move towards more greener public transport, etc. I know that doesn't help in the short term, but it's very much I can only take it back to the local team.
Thank you very much. Comments would be much appreciated. Thank you.
Thank you.
Councillor Nicholl and then Councillor Garden, and then I'll finish this item. I just want to emphasise that I did invite Mr. Meikle to speak particularly about GP the estate. So I'd like just to try and stick to that if we can. Thank you. You're on mute, Danny.
Thank you, Chair. £1 in the jar. It was just an observation. I was sitting here listening to the conversation and getting slightly twitchy because it's aside from the investment programme that the government has announced around the new hospitals, some of those aren't necessarily new. They are upgrading of hospitals that are in desperate need of it. There are a number of them, I appreciate, so there's work to be done. But historically, or certainly in recent history, new hospitals is not necessarily what we need, because they are expensive and they centralise things, and the drive has been to decentralise healthcare to health hubs, to include non-clinical and clinical, like we're hoping to see in Ebbsfleet. So if we can take services away from centralised hospitals, people don't want to go to central hospitals. If by and large, when you look at some of the PETs, I think that's the acronym, the patient surveys that are done, people would much rather go to access clinical services in the community if they can. So taking some of those services away from the hospitals would be and has been government policy and is to be encouraged. The only other thing I just wanted to say was that in defence of Ebbsfleet, because there is a suggestion, it's new people moving in and they're making the problem worse. Obviously, we welcome people want to move to Dartford. We welcome that. We encourage that. The growth of the communities and places, building communities people want to live should be welcome and encouraged. The developers, as part of phase, the Castle Hill community that's being built, offered up a building for, I believe it was a 2 or 3 GP centre in a building that was built with a GP surgery in mind. That was the intended use of the building. For whatever reason, it was before councillors were elected, the 3 councillors were elected to represent the area. Whatever the reason, whoever was involved in the conversations with the CCG and others, the opportunity was lost because we didn't have our ducks in a row, and people will say, oh, we didn't do this, we didn't do that. It's all history now because the building has applied for change of use. The developers, the CCG didn't offer up the GPs, or we couldn't find them, whatever the reason might be. We lost the opportunity. So the developers have so far with the existing EBSI community, did try to offer up a building for the purpose of being a GP centre or a small GP clinic in EBSI itself, but the opportunity was lost. So now we're having to wait for the Alkerdon site, as David mentioned, which I believe is a 6 or 7 GP intended building that's going to be come available, but again, not for a number of years. So I just wanted to make that point. Thank you, Chair.
Noted, thank you. Councillor Garden.
Thank you, Chair. David, going back maybe before your time, there was an initiative to get additional car parking down at Bluewater, which is not far away. And as long as Transport for London don't remove some of the buses, as they tried to do, they've got a very good transport facility from Bluewater up to the hospital. What has happened to that initiative? And can I also say there's another initiative, which is to run an autonomous bus experiment, a driverless bus, Route 96 from Bluewater as far as, and only as far as Darrington Valley Hospital. That ties in nicely to solving the problems my colleagues have in Darrant with car parking, move them down to Bluewater, get them on the autonomous bus, and then I think many people will be happy. What is the Trust going to do to encourage such a way of looking forward? As you said, using technology and using facilities which are around.
Well, Councillor, as you said earlier on, it's before my time. I've got no knowledge of that at all. But yet again, when I raised the car parking issue that you raised previously with me, I will include that with the trust management and get back to you. Yeah, on that one. Thank you. Thank you.
Thank you. So to summarise, I'd like to thank Mr. Meikle, and particularly as you're in an interim role, it must have been particularly challenging for you to be an expert on this subject. I really appreciate it. The provision of GP practice in the borough is something I would like to return to this time next year. And I take Councillor Garden's point about the fact that we need the GPs as well as the GP surgeries. I accept that. And I'm pleased also that there is a new permanent director being appointed to succeed yourself. Very glad to hear that as well. Two points in particular. I'd like to emphasise the democratic representation on the board will help many of the issues we've talked about today. So that's something else that I want to persist with. And secondly, the trust is able to object to the provision of new housing when applications come in. If there is a struggle to provide the health services, then that option does remain open to the local trust. Thank you very much, Mr. Meikle, for joining. You're very welcome to leave now. We'll move on to our next agenda item in one moment. Thank you very much.
Thank you very much for having me, Councillor. Thank you very much.
You're very welcome.
Thank you, Chair. Thank you. Thank you, everybody. Bye-bye.
Okay. Thank you, everybody. Item 9, the next item I will take as read. It's this is more specific to the council and our function in delivering health improvement within the borough. The report was circulated in the papers, and I've got some questions on the report myself, and then I'll open up to anyone else that has any questions. But before we begin, I'd like, if possible, for Councillor Allen. Councillor Allen is the cabinet member with responsibility for health, and I'd just like to ask you, if possible, Councillor Allen, to explain how, on a regular basis, you oversee the provision of health improvement services by the council, how you liaise with the people who deliver those services, and how you oversee the effectiveness. If that's okay, Councillor Allen, thank you very much.
Yes, that's fine. We do meet 3-4 times a year with our excellent member of staff who carries out a lot of the initiatives that we're doing in the borough. At the meeting, we do have quite a lot of representatives from various health organisations and groups within the borough. And as I said earlier, we look at the opportunities that there are there within the borough to provide it. We have an obligation as a council, don't we, to provide certain facilities, and we do that with just our parks or our open spaces, our sporting facilities. But the work that Cash does particularly as well is, and it helps me as well as being a Kent County Council as well, work with the local children's partnerships. A lot of the work that we do is with the youth and their particular health issues. The Youth Council are very good and engage in it as well. And we, as I say, we meet 3 or 4 times a year and work on that. Cash does a lot of work in the schools, engagement with parents, and that's Healthy Weight, Healthy Living Centre. With it might be, a lot of our village halls have all got yoga and Keep Fit, and different craft activities are all part of our mental health and well-being. So again, it's kind of just looking out there in the community and seeing whether we can capture all that and come up with a health, health opportunities for health and well-being within the borough.
Thank you very much. If I could move over to Kashmir Power now. As I said, Kashmir, I'll take the report as read, but I'd be very grateful if you could just introduce yourself to the committee and just explain your role in health improvement. Thank you very much. And then we'll go to questions. Thank you.
Sure, thank you. So good evening, everyone. My name is Kashmir Power. I'm a nutritionist and I am the health team lead for Dartford Borough Council. I sit within the policy and corporate support team, and my line manager is Adrian Gowan. My post is funded by KCC Public Health, and I'm commissioned to deliver health initiatives in Dartford, working along the report and the initiatives in that. I'm commissioned to deliver the One New Kent service. The One New Kent service is an integrated healthy lifestyle service that tackles things like obesity and just tackles unhealthy behaviours.
Okay, thank you very much. Mike, obviously, the pandemic has significantly impacted the provision of health improvement, and I just wanted to ask how what that impact has been. So has health improvement been able to continue during the last year of the pandemic, and in what ways have you had to adapt provision of health improvement at a time when probably it's even more important for the residents of the borough? Thank you very much.
That's really interesting, because when we first went into lockdown, everything sort of came to a standstill. So a lot of the projects that I deliver are face-to-face. So we go out in the community working in our areas of deprivation. So we deliver weight management programs. We deliver exercise sessions in our deprived areas. We run health walks and we run falls prevention. So everything came to a standstill. So it was looking at how we could adapt our programs so that we could use, we could still engage with people, but look at digital platforms. The problem in Dartford was that we had digital poverty, and that's what we were faced with. We had a lot of people that wanted to engage, but actually didn't have the skills to engage. Those were additional barriers for them. As time has gone on, what we have found in Dartford, in comparison to the other areas, that actually our referrals have increased, and they've increased phenomenally. And some of the problems that we are seeing are very, very complex. So we have really had to align our services with the other services that are out there. So all of our community groups, our voluntary sectors really needed to kind of align to make sure that those people that needed the most support got that support. So what we have now started doing is we've started delivering our programs, our weight management programs digitally. Now, that means that those that can't engage, what we're doing is we're helping them on a one-to-one. So we would ring individuals and send out information via either email or via post. So we're doing everything that we possibly can to make sure that those people that want to engage can engage. The other thing that we have been doing is we've been running workshops. So for those people that really haven't got the skills to engage or were particularly nervous about engaging on a digital platform, we helped to break those barriers down. So we gave people opportunities to kind of link in with us so that we could support them. So we are currently at the moment running weight management programs online. We have got 18 people engaging, which is absolutely fabulous. Every so often I go into the office and get material from the Bishop Hart Foundation, and we send that out to our clients. We've got 2 exercise sessions running, and we're running them again via Zoom. Now, we started off with very low numbers, but we've now got an average of 16 people on 2 sessions that run every week. And again, the referrals that are coming through are absolutely phenomenal. We've got a real increase. We are looking at some point going back to delivering our health walks. Our health walks are a lifeline for some of our elderly people. We are looking at how we can run some events so that we can get people together when we can get people together to really sort of encourage people to start walking. So we're looking at running, I'm in the process actually at the moment of working with our comms team to create a leaflet that kind of gets that message out there that we will soon be back to the new normal. So we'll be advertising for walk volunteer leaders, because I can see that we're gonna lose a lot of our volunteers that used to be there. These were our communities. So we've got a lot of work to do in terms of building those communities, but the work is kind of there in the background at the moment. So we're working on initiatives where we can try and promote those walks, try and build those communities up. I'm just very lucky because I've got some absolutely wonderful walk volunteers that have contacted me and said, look, how can we link in and support? Falls prevention groups, again, they came to a standstill when COVID struck. We contacted everybody on our programs, and we made sure that they were given support. We gave them leaflets as well as the exercise band so that they had the capacity to exercise at home. So we've kind of done everything that we can do to make sure that we are engaging with those people that need help and support the most.
Do you have any sense of how much people have been exercising in lockdown? It seems to me anecdotally that a lot more people are going out for walks, and people can't go out and undertake unhealthy activities such as drinking in pubs or eating in restaurants. So do you have any sense for levels of healthy activity? I appreciate that's quite difficult, but
No.
what's your view?
Well, certainly I was going to say, Cash, sorry, I'll just say, Cash, that I'm certainly very aware. Go, I'll give way.
Oh, sorry, I'm so sorry.
That's okay, go on. You carry on and I'll pick up.
I have today received 7 referrals, and practically every referral that's coming through is asking for support. So once we go back to the new normal, I'm just hoping that I can run those exercise sessions face to face. and not have to charge, because we really want to get people engaging. People want to exercise. People are finding it really difficult exercising indoors, but I can see that there's a demand for it. And I'm sure that the advice that our advisors are giving is do something, stay active, because we know that has an impact, not just physically, but mentally as well. So we are certainly positively encouraging everybody to be as active as they possibly can. But yes, I think people are actually doing that already.
Thank you. Thank you. Councillor Allen?
All I'm just going to say, I'm certainly just aware, even because I live up here on the heath and that, there are so many people. It's amazing when you go out, you see so many people walking all the time. And I think for me, a lot of people have actually discovered Dartford. As a councillor, you get complaints. People are saying to me, well, that path from Leighton Cross to Bexley Park is really muddy, and could you do something about it? And I'm thinking, for heaven's sake, this is Heathland, you know, paths are like that. But people are actually discovering the public footpaths, they're discovering the parks. We had complaints of too many people in Oakfield Park. You know, it's there, and I think we've got to build on that. There is this awareness there, but I think, again, we've got to manage it in a certain way, because there's a lot of jewels in our crown in Dartford. And you look at all the country parks, the riverside walks and things like that, and I think there's an opportunity, because people have discovered this, that we've got to, certainly as well, we do a little a Healthy Living Centre as well. We have a bicycle loan scheme that you can even borrow a bike if you want to take up cycling, because I think more people will. I've been asked at the Joint Transportation Board from the cycling community to say, could they come and do a presentation, because the cycle for the cycle routes and the cycle paths, I think there's another opportunity there where we can encourage a bit more walking, cycling and things like that. So I think the pandemic has made more people aware and more appreciative of that there could be a different lifestyle here. There'll be a lot of people who actually say, actually, I don't want to go back to sitting around. I actually quite like going out for a walk every day and things like that. So hopefully we can capture all that.
I completely agree, Councillor Allen. We'll be looking at the heath and the country parks and the marsh in our next meeting. I've certainly found parts of the heath I never knew existed, and particularly your side of the A2. But I've got as far as Hextable from my front door, and I think it's extremely good for mental health to have new vistas. I've got one more question, then I think
just to say, just as a plug for my area in Council Garden, we have an ancient woodland called Jordan's Wood, where the lilies of the valley grow wild up there. It's a very old ancient woodland, and you know, it's a lovely woods to walk in. It's not very far away. I mean, the problem is that we're getting complaints of all the people who don't actually walk there. They drive there and then park their cars. So again, it's another thing. But again, there are some real good places to be in Dartford.
Indeed, as Councillor Allen said, we end up with a big car park outside it on Summerhouse Drive, and particularly in Northfield. But there we are. We live in a nice area. Why should we stop other people coming to use it?
Thank you. Sorry. There's some exercise equipment in the park, which is currently fenced off, and I'm a bit worried it's going to be unserviceable when it comes to be opened up to the public. I don't quite know whose responsibility that is, but I suspect it might be Rusty and Kashmir. Do you have any ideas if we can check that it's being serviced and will be available once it's allowed?
Would you be able to elaborate which one, which green?
There's some exercise machines in Dartford Park, not far from the cafe, which are fenced off, but they have mechanical moving parts and they've been out, not being used. Can I leave that with you, perhaps?
I think that would be our Parks Department, as and when we start to reopen the park. I think that they would have a duty of care to check that, as they would check all the playground equipment and other things. So I think that might be just one for our Parks Department to take up. Or Adrian, if you're listening, have a look.
Thank you. So Councillor Green, then Councillor Sandhu. Thank you.
Thank you, Chair. I've got a few points I'd like to make, if I may. in reference to the Health Inequalities Action Plan, have we got any evidence that we are tackling health inequality, that there are any difference in the outcomes that we've seen with, for example, different lifespans for people in different demographics and different parts of town? Can we see any overall fall in any of those figures? The other thing I'd like to say is I'm a bit surprised there's nothing about mental health within the plan. Have we got any kind of work going on to prevent health inequalities with regards to mental health, which we know is a kind of second pandemic alongside the COVID pandemic? And the other thing I wanted to talk about was messaging. We know there's been a lot of demographic change in Dartford in recent times, which is to be welcomed. One of the great lessons from the vaccine is that different people from different demographics respond to different messaging, and that needs targeting. Are we looking at different targeting to engage different types of people, different ages, different races, etc., to take up some of the opportunities to improve their health?
Thank you for that. In terms of, are we making a difference? I would hope we are. It's very difficult to measure, isn't it? Very, very difficult to measure. Long-term effects. I would say the only answer and solution to that is the public health guidelines that come out. We can only compare ourselves with that, but it's a very difficult thing to measure. But that's something I could look into and certainly report back in terms of where we are in comparison to where, you know, a few years ago. I can certainly look into that. Mental health, we're not actually commissioned to deliver mental health projects, but we link in very much with our mental health organisation. So that's a very strong partnership that we have with Mind and Live Well Kent. So mental health is something that we are going to be focusing on a great deal. We have certainly seen an increase in people wanting support for that. So this is where we would link into the services that are out there. In terms of our BAME groups, we are doing a lot of work. We are trying to make sure that we are targeting all of our demographics. So in terms of geographically, Dartford has a lot of different areas in terms of deprivation. So some of the KPIs that we target are working with our areas of deprivation, so our quintiles 1 and 2. So we really do look at how many people are actually engaging with us from those quintiles, and that's why we tend to sort of, when we are working in the community, we try to make sure that we have our projects running in those areas so that those people have access to all the interventions that we run. As far as the BAME groups are concerned, Councillor McLean very, very kindly did link me in with a group within our community, and we have just delivered on the 2nd of February a BAME engagement event, and it was really to promote health and well-being amongst the Afro-Caribbean community. We had 32 people engage on that event, and we used that as an opportunity to not just talk about the One You, but to talk about how we really need to get them to engage in some of the activities and the interventions that we offer as a council. We also used it as a platform to talk about asking people to get vaccinated. So we are doing our absolute utmost to try and engage as much as our BAME community. With regards to, I've also got links with the Temple in Dartford, and once things kind of get back to the new normal, this is something I will be looking at doing, engaging again the Asian community that perhaps aren't. Interestingly enough, actually, demographically, we are seeing an increase from that population, from the BAME community, which I'm really pleased about, as well as men who don't always engage.
Thank you. Councillor Sandhu, thank you.
Thank you very much, Chair. Thank you very much for that presentation and introduction. regarding, so my point was going to be regarding the exercise equipment in Central Park as well. And just so you're aware, I have been liaising with Dave Bennett, who is aware, and he did advise me that it would get looked into, but I didn't know when it was going to be. So, you know, I'm just glad. Well, hopefully it's been looked at and it's not all broken down, and that's why it's been cordoned off. Because I said, you know, we, as a community, we've, I've actually been liaising with Dave for a number of months now regarding those facilities, because, you know, especially in the current climate, I think a lot of the elderly do prefer the walk or the stroll just in the park, along with those exercise equipments. It just gives them that extra flexibility to be able to do that. And it's very, very pleasing to hear that you will be coming to the Sikh temple as well to encourage individuals there. That's it. That's, you know, I know you and I have spoken about it in the past, but we've in the lockdown, I think we discussed it back in around about February last year, and then March we had the lockdown. So, you know, it is good regarding that. But yeah, you know, I think as one of the other speakers mentioned, it would be nice to actually have some kind of statistics, whether the there is more walkers. You know, how you'd find out, I don't know, you know, but I do regular walking now, whereas in the past I maybe didn't. And you see the clusters of people, you know, along the main roads and in the heath, etc. You know, I remember the first time I went to the heath, I didn't even know it was there. You know, those parts, and trying to follow the path. So once you're in, you know, you've got to learn how to get back out again. And it's all, you know, number coded, you know, and you don't realise, but it's fantastic. And I think, as you mentioned in the past, you know, that there is so much in Dartford that we don't realise. And Councillor Anne Allen, I will be coming down to Jordan's Wood Park as well one day, just to see that as well, because I think it's a great facility, and I'm just waiting for my grandson to come, and then he loves his parks, and so I will be bringing him down whenever the opportunity arises. Thank you.
Chairman, if you just let me sort of just come in there again regarding my particular portfolio as well. We do have an elder forum where we take the opportunity to introduce lots of health, you know, initiatives, information, always at the elder forum. I know that the team, Elaine Henson and Belinda, have actually taken an opportunity to send out a questionnaire to, because we haven't been able to meet for nearly a year, to all the groups and organisations there to find out what's going on in their communities and the way they're engaged. So there's a piece of work that's going on at the moment, and we hope that when the new director comes in as well, we'll be trying to get some more community information there. And the Youth Council have been absolutely fantastic, although they're having virtual meetings. They're actually doing a study on the impact of the COVID for them, not being able to go out and see their friends, how they're working. They talk very openly about mental health and some of the tools that they've been accessing. And we're taking that to the local children's partnership, which meets with all the children's groups. Certainly, again, school's back this week. Head teachers there have said that one of the things they want to do is to focus on getting young people back, because whilst academically they perhaps, you know, want to get up to speed, they're very keen that when they come back, they actually start going out, play netball, play football, engage with their friends, go to the dancing and those sort of things. That's one of the other things that they've missed, is these group activities, again, which is so important for their own well-being and mental health. So there is some work that's ongoing, but, you know, doing our best. Thank you.
Okay, if there's no other questions, I'd like to thank Ms. Power. Thank you very much for your report, much appreciated. And thank you for your work on health improvement. It's an annual report, so we'll see you again in a year's time. And I particularly want to note my thanks for your work during the pandemic, which made things particularly difficult. So it's much appreciated. Hopefully in the near future, we'll all the organised swimming and football and other sports and darts and snooker will get underway again, and we'll all be much healthier. So thank you very much. Councillor Allen, you're welcome to leave or stay as entirely as you see fit. Thank you very much, Ms. Power. Thank you. We'll move on to item 10 in a moment. Okay, thank you. Item 10 is the food security policy. Again, I'll take the report as read. I think councillors know that this derives from a General Assembly of the Council 2 or 3 months ago, and is a piece of work that will be ongoing. I don't know whether, Mr. Gann, there's anything you want to say at this point. I don't know if you can give any high-level overview of how that's going to be taken forward or not, and then I'll open for any questions and comments. Thank you.
Okay, thank you, Chairman. I think it's pretty self-explanatory. I mean, obviously, Councillor McLean was going to be leading on it, but he's now stood down from the council. So obviously we'll await the appointment of a new lead for equalities, but that doesn't mean that we'll stop the work itself. I've put an example of a food policy onto the back of the report. I mean, obviously that's for Norwich, and it deals with the issues which they've identified in Norwich, but it gives an idea about the sorts of areas that a food policy would look at, and we can certainly take that piece of work forward, even without the lead member at the moment, because it's going to be very much doing, I think, some research with the local food banks and with local organisations to try and understand. I mean, obviously, over the period of the pandemic, we've made a very close relationship with a lot of organisations in the borough. So I'm sure we can go out and get the information which will feed into the policy.
Okay, thank you. So there is some officer resource available to progress that in the meantime. I think to some extent it's information gathering about things that are already happening, but perhaps need to be connected up and collated. And in terms of the lead member, do I need to do anything about that, or do we just need to wait? Perhaps that's something that the annual general meeting will address. Yeah,
I mean, I think cabinet have got the ability to appoint if they're so minded to do it.
Okay. And it is something we will return to as a committee. I think the aim is that we agree an action plan. I'm a fan of pragmatic, achievable actions, and then monitor implementation. Thank you, Mr. Gavin.
I can give you a timetable.
Yeah,
Chairman. I mean, we could certainly prepare a timetable in which it could be prepared, certainly so that you can have a draft.
Thank you.
Either at the next meeting or the meeting after, but certainly we can do that.
Okay. Does anyone have any questions or comments? Councillor Green. Thank you.
Thank you, Chair. As I said when I brought this, or the original version of this motion, to the General Assembly, there is some really fabulous work going on in the town with regards to food poverty, but I think there's a little bit of a problem that it's not necessarily joined up, and it's done by a lot of very good organisations. So I would suggest it would be a good idea to get all the food banks, the YMCA, all the people that are delivering these kind of services in one room and hold some sort of conference and discuss their experiences, their plans and the difficulties that they have together, and go from there. That would be my suggestion. And having worked with and spoken to a lot of those organisations, I think they would really welcome that.
Thank you. I forgot to mention that the leader did write to the Food Minister, which was one of the other items from the GAC. I don't know if there's been a reply or not. Councillor Sandhu.
Thank you very much, Chair. I think Councillor Green has raised the issues that I think, even as rightfully you said, it's about collating all the information and putting everybody in touch with everyone so that we know what's happening. Because, you know, we do, from the Sikh community, we also do Sunday feeding. And again, I think it'd just be nice to know where everybody's supposed to be, so that at least if there is any individuals or groups that may require food, they know exactly where to go on which day, you know. And I'm sure within the borough, we most likely do cover all 7 days one way or another. And I think it'd just be good to keep them all informed, and we know what's happening as well, because I think statistically we can have good numbers between all the groups, so that we all know what's going on. Thank you.
Thank you. Are there any other questions or comments?
Matthew, I'm still here and I'm listening with great interest, because the Healthy Living Centre, we coordinated during the emergency time, where we were delivering food parcels ourselves at the borough, where people were contacting the borough for help and support, and we did quite a lot of that. On the back of that, we already were doing an initiative about reducing food waste. It wasn't necessarily about poverty, it was about food waste. And but we still do that 3 days a week, and I use that as my essential exercise. And I'm outside the community centre on the Tree Estate, and we're able to give a lot of free food away. And I say to people, this isn't about being poor, this is about not wasting things. But I'm very aware that a lot of people are finding it extremely useful and helpful in these difficult times. Also, what we've been doing, we're aware that there were some rough sleepers and things like that with staff at the council. We took them all in, and they've had opportunities to perhaps help and support them further, and hopefully they won't be returning to the streets, because whilst we've had them in lockdown, we've been able to do some more intensive work with them. But we've also taken the opportunities, as though they were getting bed and breakfast. We are using Tree Estate and Temple Hill, where we're actually 2 days a week, we're giving a meal, a nice a meal to them, delivering. We purchased all the takeaway packs, and they're getting a hot meal as well. And I know 1 or 2 of the churches are joining in covering other days. So there's lots of good stuff in there. We just need to link it up, as you say, and find out all what's going on. But certainly, again, I'm very keen on working on food waste, not to say, and lots of people have been donating surplus stuff from, you know, their gardens, their allotments. Shops are ringing up and saying, we've over-ordered, do you want this? And as I say, income and food banks were there before the pandemic. So I think it's, again, an opportunity to take stock and see where we're doing. I know there are other schemes going on in Swanscombe and in Greenhide and things like that. So, yeah, good stuff. But, you know, let's have a look and see what's going on.
Thank you. If there's no other questions, I will rely on Mr. Gowan in future to advise on progress and a timetable and consideration of when we next need to overview our food security policy. I think that's it. I'd like to thank the officers for giving up their time to support the meeting. I'd like to thank our guests, Councillor Allen, Ms. Power and Mr. Meikle. And I believe the next meeting is Tuesday, the 9th of June. Thank you, everyone, for your support, and I look forward to seeing you in the near future. Thank you very much, everyone. Take care.
Yeah.
Have a good evening.
Thank you, Chair.
Thank you, Chair. Good night, everybody.
Good night, everyone.